Hello, everyone, and welcome to today's live broadcast, The Delightful Vitamin D, A Global Perspective, presented by our keynote presenter, Michael F. Holick, Ph.D., M.D., Professor of Medicine, Physiology, and Biophysics, Director of the General Clinical Research Unit, and Director of the Bone Health Care Clinic, and the Director of Heliotherapy, Light, and Skin Research Center at Boston University Medical Center. I am Christina Mahalik of LabRoots, and I'll be your moderator for today's event. We are delighted to bring you this educational web seminar presented by LabRoots. LabRoots is the leading scientific social networking website and producer of educational virtual events and webinars. Before we begin, I'd like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want at any time you want during the presentation. Just click on the green Q&A button located in the lower left of the presentation window and type your question into the box that appears on the screen. Dr. Holick will be following up with you via email. Please notice that you will be viewing the presentation in the slide window. To enlarge the window, just click on the screen icon located on the lower right. If you have trouble seeing or hearing the presentation, please click on the support button at the top right of the presentation window, or use the Q&A button to let us know when you're having a problem. This presentation is educational and thus offers continuing education credits and will be available for on-demand viewing through February of 2018. Please click on the button in the bottom left corner and follow the process to obtain your credits. Please join me in welcoming Dr. Holick. I will now turn the presentation over to our speaker.
Hello, I'm Michael Holick, and I'm going to be giving you a very broad overview about vitamin D and hopefully convince you that this is a delightful hormone. Now, I knew I was in trouble because what am I going to tell you about vitamin D that you don't already know about? Well, one thing you may not be aware of is, guess what? Worms need vitamin D, and I'll tell you that at the end of the story. So I have this varied audience, and I know you have a wide range of experiences, so I wondered how I could really get this message across. So I went to a higher authority, a doctor that I think you all know and respect for his wisdom, and I asked him for some advice. And this is what he told me.
You're an idiot.
And so basically he's saying that I'm an idiot because what am I going to tell you about vitamin D that you don't already know about from the Institute of Medicine report? Well, it turns out that the IOM came out with its recommendations in 2010, and they're really quite remarkable because they realized that the 200 units that was originally thought all that we needed, that now most children and adults need 600 units a day. And more importantly, they recognized that it was important that you also vitamin D is not as toxic as we once thought, and that easily 4,000 units a day for older children and adults is perfectly safe. So when I think about this, and I'm always asked by the press, what do I think about it? I have one word for it: wow. There's never been a nutrient that has been increased triple overnight, but the real question is, did they get it right? And indeed, in 2011, the Endocrine Society came out with its recommendations. And all of the members on this committee are experts in the field of vitamin D, and I was honored to chair this committee. And our objective was clear, and that is to help treat and prevent vitamin D deficiency and for the care of patients. The Institute of Medicine's goal was different. It used a population model and expected medical societies to make recommendations for prevention and treatment, which is what the Endocrine Society did. And indeed, it turns out that the recommendations for infants is 400 to 1,000 units a day, children 600 to 1,000 units a day, and adults 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more vitamin D. And so it turns out that people worry about conflict of interest, so I do get support from NIH and I consult for a variety of companies, but much to the dismay of the dermatology community, I get support from the Sun. And for those that are interested, you can go to this website, drholick.com, for more information. Now, I have been talking about vitamin D for more than 40 years, and people could not think of a more boring subject than vitamin D. Found in cod liver oil, prevents rickets in children. We don't see rickets commonly. We're not thinking about vitamin D deficiency. So what is she thinking about? Well, who is at risk? And I hope we convince you that everyone is. He's worried about global warming? No. What is the big deal about vitamin D deficiency? Because really, rickets is the tip of the iceberg, because many chronic illnesses and bone diseases like osteomalacia and diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension, heart disease, even common cancers have all been associated with vitamin D deficiency. Indeed, Discover magazine in 2007 suggested of the top 100 medical breakthroughs, number 8 came in, can vitamin D save your life? Time magazine, same year, 10 biggest medical breakthroughs, more health benefits of vitamin D. Now, we're always taught, of course, to publish in the major medical journals. No. Here, Fitness magazine is the super vitamin. And if you want to get your teenagers' attention, there's only one place to publish, Teen Vogue. And in fact, it's been the problem that the doctors weren't getting it. It would be the lay public that would go to the doctor saying, please get me my blood level. But the doctor would refuse. Patient persists. And now the doctor's got religion because finds that the patient's vitamin D deficient. The assay for 25-hydroxy-D is the most ordered esoteric assay now in the United States. And 1 in 9 Australians even now have a blood level drawn. So vitamin D is a sunshine vitamin. And so I wondered about these dark-haired Neanderthals, how they could have survived in a northern European climate. And it turns out that DNA has now suggested that they were red-headed and Celtic. The driver in evolution is clear for hyperpigmentation. You see on this pelvis is a normal female, and this pelvis of a female that likely had infantile rickets. She would have had a difficult, if not impossible, time with childbirthing. So within a few generations, pigmentation disappeared, devolved in order to produce enough vitamin D. Now, we showed many years ago you can't make any vitamin D in Boston in the wintertime. So I took my daughter on safari to Kenya, thought we could write it off on our taxes and medical expense. Doesn't work. However, this Samburu warrior is perfectly designed for his environment. So how do you really compare and contrast? So I figured there's no question that my gene pigment devolved in order to enhance vitamin D production. And so how do you make vitamin D? When you're exposed to sunlight, it's the precursor 7-hydrocholesterol in your skin, absorbs ultraviolet radiation, converting it to vitamin D. Now you have to wonder about, can you make too much vitamin D from excessive exposure? She's got a lot of bad habits, but one thing you don't have to worry about, you will never become toxic. And the reason is that any excess is destroyed by the sun. Now I'm always asked the question, sunlight versus supplement, does it make any difference in terms of how the body reacts to it? And he's a poster child, of course, for sun exposure. And yes, when you make it in your skin, it lasts 2 to 3 times longer. For humans, the story begins in the Industrial Revolution. These kids in these alleyways, not exposed to any sunlight, develop classic rickets, growth retardation, and the skeletal abnormalities. It was 2 physicians in New York City, 1921, that demonstrated that they could cure rickets simply by exposing them to sunlight. This led to a novel concept. Our government set up an agency in 1931, sending out this brochure telling parents to send your children outside, expose them to sensible sun exposure to prevent them from getting rickets. But in fact, they patented this concept back in the 1930s. Mommy, will I make enough vitamin D? But of course now everybody worries about skin cancer. And so for 40 years, really unchallenged, have been the dermatologists telling you never to be exposed to one direct ray of sunlight. In fact, if you ever put your child outside without a sunscreen, here at least in the United States, you could wind up on America's Most Wanted for child abuse. Indeed, this is the problem. Cows don't put vitamin D in milk. Right? It was Harry Steenbach in Wisconsin in the 1920s that realized if you can irradiate people and animals, why not irradiate the food? That led to the magical Steenbach vitamin D process, the fortification of milk with vitamin D, and it essentially eradicated rickets. But the problem is, of course, in this day and age, do you know why vitamin D is so tightly regulated worldwide? Most European countries do not permit you to buy a vitamin D supplement over the counter. And in South America and in Asia, it's the same issue. Why? So it turns out that you might think that this had always been the case. Not true. It turns out that before 1950, many products throughout Europe were being fortified with vitamin D. Here in this case, custard. Even in Chicago, hot dogs were being fortified with vitamin D. And so, yes, it turned out that around 1950, Europe forbid vitamin D fortification in milk. Why? The reason is, in the 1950s, a few infants presented with high blood calcium, altered facies, mental retardation, and heart problems. The experts were brought in because they had no clue what was going on, and they said, yes, pregnant rats who get high doses of vitamin D, their pups have high blood calcium, funny altered facies, and heart problems. So they concluded the most likely reason for this problem was overfortification of milk with vitamin D. And as a result, Europe banned fortification not only of milk, but of all products. That these regulations are still on the books today throughout most of Europe and most of the world. And so as a result, neonatal hypercalcemia banned the overfortification of milk. But likely, these children had Williams syndrome, a rare genetic disorder associated with funny faces and heart problems, mental retardation, and a hypersensitivity to vitamin D causing hypercalcemia. But unfortunately, this ban continues to this day. So vitamin D is essential for bone health. So I thought I'd bring you a couple of cases that you may not typically see in your own practice. This 7-month-old female, muscle weakness, seizures, calcium of half normal. Turns out it's the first lowland gorilla born in captivity at our zoo in Boston. And it turned out that it was just about to die. Seen by a pediatrician, given 400 units of vitamin D, didn't do any good, and concluded this infant had some rare genetic disorder, nothing we could do, and wished the caretaker good luck. Well, it turns out that baby's complaining to mom about bones aching. Dad's upset. He knows his daughter's in deep trouble. Have you ever wondered what he was trying to say? This is what he was trying to say. Indeed, finally, they suggested that I get to see the infant, and mom said to call me. And the infant has classic widened epiphyseal plates, classic for vitamin D deficiency. So how do you treat? Aggressively. So I gave the infant 5,000 units of vitamin D a day, and the infant's feeling great. In fact, I was the guest of honor for her first birthday. What's the message? Mommy, will my growth be stunted? When you went to the zoo to see her for her first few years of life, her growth was stunted because of her in utero and her first few weeks of life of vitamin D deficiency. Why should you care? Because we still estimate more than 50% of infants born, even in the United States, but worldwide, are born in a deficient or insufficient state. 1889 in Boston, rickets was common. So is this a problem today with all of modern medicine? You better believe it. We see about a dozen cases a year at our hospital. Why? Because there's a naive concept out there that human breast milk will provide the infant with all of his or her nutritional requirement. It will not. There is essentially no vitamin D in human breast milk. So if you give your infant human breast milk as a sole source of nutrition, that infant will be vitamin D deficient for that period of time. I'm not sure what she's thinking about, but we asked a question at our hospital, are pregnant women at risk if they're taking a prenatal vitamin? And we asked the question that if they're at risk, and we looked at 40 mother-infant pairs and measured vitamin D status, and demonstrated that they were taking 600 units of vitamin D a day, the amount recommended by the Institute of Medicine for all adults, including pregnant and lactating women. And we went on to show 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because we showed with Lisa Bodner, preeclampsia is associated with vitamin D deficiency. And in fact, again, early pregnancy and vitamin D status and risk. It's not so much taking it after you started the pregnancy, but it's really important to have vitamin D on board early in pregnancy to help reduce risk for preeclampsia. And indeed, preeclampsia is lowest when your blood levels, pregnant women, are about 40 to 50 nanograms per ml. Right? So who are they? These are 3 children born by cesarean section back in 1889 in Glasgow, Scotland. Why? Because mom had a flat, deformed pelvis because of infantile rickets. And so it turns out that also vitamin D is critically important for proximal muscle function, and that's important for birthing. And so we went on to show in over 200 women at our hospital that if they're vitamin D sufficient at the time they give birth, they have a 400% reduced risk of requiring a cesarean section. Right? And so I'm not sure what Christina's thinking about, but we recommend all pregnant women should be on 2,000 units of vitamin D a day. In fact, maternal vitamin D insufficiency early turns out that if you're greater than 40 nanograms per ml, 60% lower preterm birth risk. That's quite remarkable. Indeed, gestational age was a function of 25-hydroxyvitamin D. 60% reduction, premature births, if 20-hydroxy-D was greater than 40 nanograms per ml. And you'll be hearing more about this also from Dr. Holick in his presentation. So how much do lactating women need? Hollis and Wagner showed very nicely, 6,000 units of vitamin D a day will put enough vitamin D in their milk to satisfy their infant's requirement. Pediatricians have been paranoid about worrying about vitamin D toxicity. And so indeed, how much do they need? And when should they be getting it? And the message is from the American Academy of Pediatrics from birth. And it should be 400 units of vitamin D a day. In Canada, they recommend up to 800 units a day. Pregnant lactating women, 2,000 units a day. 1-year-old female, muscle weakness, bony deformities, and failure to thrive. I don't know if you've heard of this, so-called the Jurassic syndrome. It turns out that because of Steven Spielberg and Jurassic Park, that about 750,000 young in the United States at risk. Well, lettuce and crickets are not a healthy diet. And it's not because of people eating crickets, it's because of iguanas. Because the kids that saw Jurassic Park wanted to have a pet dinosaur. And what better animal to have than an iguana? So about 750,000 are imported in the United States every year. They're given a steady diet of lettuce. There's no calcium or vitamin D, and they wind up with osteoporosis and osteomalacia. They fracture the rib cages, their long bones, they fall off the perches, and they die. Well, my 9-year-old daughter went to see Jurassic Park with me, and she wanted a pet iguana. Well, I couldn't have a pet iguana die of a calcium and vitamin D deficiency. So what do? Keep up with the literature. And the reptile literature says metabolic bone disease. This is what happens when you're vitamin D deficient. Increases risk for vertebral fractures. Now, I give a lot of presentations to doctors and show a patient like this. Nobody cares. But you'll remember that vitamin D deficiency increases risk of vertebral fractures and non-vertebral fractures. So now what to do? How do you treat it? Well, just like for our patients, how do you get them to take their calcium? Well, I gave it some milk? No. I gave it a calcium supplement? No. So he's not foaming at the mouth. He's getting low-fat cream cheese in between the lettuce. So he's getting all the calcium that he needs. There's no vitamin D in low-fat cream cheese. So what to do? Well, they like to be outside because they make lots of vitamin D. So you know how industry rises to the occasion when the opportunity is there? You can go to your local pet shop and buy Reptisun for $40 that mimics sunlight so that your pet reptile at home will make vitamin D in its skin. We do this for our nursing home residents? No, but we will do this for our pet iguanas. So there he is smirking at me because I just spent $40 so he could make some vitamin D in his skin. So I have a very happy daughter with a happy iguana. And you need calcium and vitamin D for strong bones and healthy teeth. And when you do that, both my daughter and her iguana grew very well. 6-month-old twins, muscle weakness, bony deformities, and failure to thrive. Major PR problem in Denver, Colorado. These poor polar bears couldn't move. They thought that they might have some type of neuromuscular dystrophy. But it turns out that most likely the proximal muscle weakness associated with vitamin D deficiency. And recommended adequate vitamin D and a little bit of vitamin D and tender love and care, and they are doing great. Also, 5-year-old female, poor dentition, dental caries, and delayed tooth eruption. Major health issue for non-human primates. But it also turns out that dental caries, of course, is extremely common infectious disease in children. And studies have shown inverse relationship with maternal 25-hydroxyvitamin D and the amount of decay in their infants in their first couple of years of life. Also, periodontitis is a major health issue, and a study done here at the dental school showed a strong association with the higher your levels of 25-hydroxyvitamin D, lower is your risk for periodontal disease. For a couple from Indonesia, they relocated to Washington, D.C. and had non-viable offspring. A major PR problem decades ago, because when Sukarno visited Nixon, he brought with him a mated pair of Komodo dragons. There were no Komodo dragons in any zoo in the United States. And so they figured that they would mate and that they would have lots of baby Komodo dragons, but they were non-viable hatchlings. I happened to be in Washington, D.C., and they called me over to the zoo to ask, because I'm an endocrinologist, that maybe they have some kind of hormone problem. I said, well, they do, but not the kind you're thinking about. They're in a glass enclosure, and they likely are not, they're not making any vitamin D, and therefore likely vitamin D deficient. Now, how do you determine that? Carefully. And how do you treat it? Equally carefully. And sure enough, we went out to show in the enclosure they can't make any vitamin D. And we gave vitamin D to both mom and dad, and they all had wonderful hatchlings the next go-round. In fact, it turns out that they need vitamin D. So it's true. Vitamin D deficiency is associated with infertility, low birth weight, and poor birth outcomes. Indeed, this study done in Dubai showed vitamin D deficiency linked to infertility. So I'm an unusual consultant, because I consult for many zoos still in the United States, because this continues to be a health issue. So is it true that vitamin D is rare in foods? You would think with a healthy diet, you don't have to worry. But with Carolyn Moore, we showed many years ago that no child or adult in the United States could get enough vitamin D from diet alone. Why is he carrying this mushroom? Because mushrooms have the capacity to make vitamin D. So sun-dried mushrooms have a good source of vitamin D. But back in the 40s and 50s, right, kids used to line up for cod liver oil, and because it tasted so good, right? We don't do this anymore. And it comes in tablet, and it comes in oil, and it comes in emulsion. And you realize by now I'm a little bit controversial on my stance of sensible sun exposure, constantly interviewed by the press, but the dermatologist said, no, just eat more fish. Well, how much fish do you have to eat? It's not a pretty sight, right? Indeed, this is my son. We go sail fishing in Guatemala, catch-release program. They don't have any. These rooster fish, they don't have any. It's only oily fish, salmon, mackerel, herring. How much do you have to eat? You'd have to eat it every day. There's only about 500 to 1,000 units. But that's not the question to ask. The question to ask is, are you eating farmed versus wild-caught salmon? Because we showed farmed salmon have only about 10 to 25% of the vitamin D content compared to wild-caught salmon. So this is where we're getting our vitamin D from casual, not so casual exposure to sunlight. Summertime, feeling great, making lots of vitamin D. Sun's coming through the ozone layer directly, and you're making vitamin D. But in the wintertime, the sun is coming in at a more oblique angle. And the question is, can you make any at all? So I got one of my techs to go up on the roof to measure how much vitamin D you could make throughout the year. And we showed in Boston, spring, summer, and fall, you make lots of vitamin D. In the wintertime, can't make any at all. Now, my colleague said, you know what, we need evidence-based medicine. And no question, my daughter, who was up in Vermont, goes down to Florida for spring break. Yes, you can make it year-round. But what about in the wintertime in Boston? And so to be convinced, right, we did studies and showed that if you live above Atlanta, Georgia, you basically cannot make any vitamin D in your skin from about November through March. So in Europe, if you think about this, most of Europe can't make vitamin D almost 6 months of the year because of their high latitude. So what about making vitamin D in the early morning and late afternoon, say living near the equator? Turns out that we did a study with a group in Saudi Arabia and showed that even at 18 degrees north, that you don't begin making any vitamin D to about 9, 10 o'clock in the morning, and it ends abruptly at 3, 4 o'clock in the afternoon. So yes, can you make vitamin D while jogging early in the morning? No. It's good for romance, but you make no vitamin D, only from 10 a.m. until 3 p.m. This is what we've been taught about the sun, and no question excessive exposure will damage your skin, increase risk for non-melanoma skin cancer. So evolution, think about beachwear. 50s is the two-piece, 70s is the one-piece, and new millennium is now lots of sunscreen, a lot of clothing. So what about vitamin D and sunscreens? And so we did a study and asked the question and showed that when you put whole body, the appropriate amount of sunscreen on, SPF of 30 reduces your ability to make vitamin D in your skin by about 95%. Right? 90 to 95% of your vitamin D is coming from sun exposure. How much? Never want to burn? Can't look like this. And coming from New England, of course, you can't look like that. But we knew exactly how long to stay outside and go back into the shade during early evolution, but we lost that ability about 10,000 years ago. So I carefully reviewed the literature. So how do you know when you make enough vitamin D? These little pop-ups used to pop out of your belly button. That doesn't happen anymore. So we did a study. And we asked the question, if you're exposed to 1 minimal erythemal dose, what is that equivalent to in taking an oral dose of vitamin D? And we showed 1 minimal erythemal dose, light pinkness to your skin, 24 hours later, is equivalent to ingesting about 20,000 units of vitamin D. So now you can understand our hunter-gatherer forefathers outside every day were making thousands of units of vitamin D. About 15 to 20% of your body's surface generate about 1,500 to 2,000 units of vitamin D. Why is she screaming? We finally figured it out. Because if you go on the internet, they tell you you should not bathe after being exposed to sunlight because you're going to wash off the precious vitamin D. Not true. You make it in your living cells. You don't wash it off. So yes, please bathe. If you've been sweating outside in the sun, you will not wash off your precious vitamin D. So does it provide you with your vitamin D requirement? Here, no matter what your ethnicity, even in Denmark, they showed the peak blood levels are at the end of the summer and the naders at the end of the winter. Now, what about aging? And so we went on to show many years ago that since keeping up with the literature, 75% reduction. But the skin has such a huge capacity to make vitamin D, is it possible for him to make any at all? And so Ian Reed and we independently showed that if you take elders and expose them to sunlight, they definitely will make vitamin D. So it is good for them to be outside, exposed to some sensible sun. So these are all of the factors related to vitamin D status. But what about Star Wars? Always coming out with these new movies, but the person I really enjoyed the most was him, and I always wondered what he was thinking. And now I know. And in fact, even Barney was amazed to hear vitamin D deficiency associated with obesity. Indeed, the higher your BMI, lower is your 25-hydroxyvitamin D. And we did a study and showed if you take normal weight and obese individuals and give them the same dose of vitamin D or expose them to the same amount of stimulated sunlight, they only raise their blood level by about 45%. Evidence-based medicine, we went to a local bariatric surgeon and asked, I need some of your fat. She said, no problem, doc. And we showed lots of vitamin D. Message is simple. Obese people need 2 to 3 times more vitamin D to satisfy that requirement. What about gastric bypass surgery? If they're losing 50 pounds of fat, do they mobilize that vitamin D and could you become toxic? So we did a study and showed that in fact 20-hydroxy-D levels don't change at all. As the fat's being destroyed, so too is the vitamin D. Pele here with his girlfriend, he has to be outside at least 4 to 10 times longer because his skin pigment is a natural sunscreen. So is it true then that people of color need much more vitamin D? And the answer is no. They just need the same amount, which is recommended by the Endocrine Society. How do you know your vitamin D status? Docs have been wondering about this. And of course, what you want to measure is 25-hydroxyvitamin D. And the normal range is usually 20 to 100. But actually, docs don't have the time to look at numbers. Is it H, is it N, or is it L? And so typically at the end of the summer, patients would come back from Cape Cod with an H. And my primary care friends would call me up and say, my patient's vitamin D toxic, what do I do? And I say, not really. I don't see the Baywatch babies in my clinic, but we do see some lifeguards. They're at least 110 nanograms per ml. Are they toxic? I don't think so. You don't have to worry about intoxication until you're over 150 nanograms per ml. What about the lower limit? That's what you should care about. And so is there evidence that you should be above 30? One of the studies that was done with Ann DePape showed that if you look at throughout the United States, postmenopausal women, and looking at their 25-hydroxyvitamin D and PTH levels, they begin to plateau at around 30. They had a 2-3 times higher risk of developing secondary hyperparathyroidism when they were 21 compared to greater than 30. Why do some patients have low 20-hydroxy-D with normal PTH? And so is it possible that there's a seasonal change in both? And we did a study. And we looked at Quest Diagnostics data set, 3.8 million samples, and showed that at the time that the PTH peaks in the wintertime, 25-hydroxyvitamin D nadir is 4 weeks earlier. and vice versa. So PTH peaks 4 weeks later in response to 25-hydroxy-D. So if you're not ordering PTH basically at the same time of the peak or nadir of 25-hydroxy-D, it makes it difficult to interpret. But in Amman, Jordan, which I came back, they have higher peak levels in the summer. But it turns out that even in Atlanta, Georgia type of latitude, with these 3.8 million samples, yes, females were a little bit better than males because they have exposed a little bit more skin. But what's amazing is that the peak blood level living down southern United States is at no different than living in the northern United States. So living in Amman, Jordan, for example, didn't make any difference. And so August was about 27 nanograms per ml for the peak. So never even reached that 30 nanograms, which is what is recommended by the Endocrine Society. Also, this IOM had recommended that only needed 20 nanograms per ml for maximum bone health. And this is based on this study of 675 German adults ages 20 to 90 that died in an unfortunate accident. Their blood and their bone was collected. And as you can see on this side, good normal trabecular bone. Here you see hardly any at all consistent with osteoporosis. But here you see the black area, but also the pink area. And that pink area is accumulated osteoid, classic for vitamin D deficiency. And it's even internal in the bone as well. And they showed that about 26.5% of otherwise German healthy adults had evidence of vitamin D deficiency bone disease. And so the Institute of Medicine said, well, if you take this over this, only about 1% had evidence of osteomalacia. So you only need to be at 20. But what they should have done was, as suggested by the authors, is that you take this over this. 24% of otherwise healthy German adults between 21 and 29 nanograms per ml had evidence of vitamin D deficiency bone disease. And this is the reason why the Endocrine Society came out with its recommendations. And because of some of the vagaries of the assays that are out there that you'll be hearing more about by one of the other speakers, we recommend 40 to 60 as a preferred range, up to 100 is perfectly safe. Is vitamin D deficiency a health issue? No question. In the United States, the CDC reported 32% of children and adults at risk. Indeed, worldwide, basically 40% of the population is deficient, 60% deficient or insufficient. UAE, one of the world's highest vitamin D deficiency, because they don't take advantage of sensible sun exposure and they essentially have no dietary vitamin D. 86% were deficient or insufficient. Also, wearing this type of clothing definitely can increase risk and is another cause for vitamin D deficiency in the Middle East. Newborns in Amman, Jordan, 94% were deficient. Conclusion, prevalence of severe vitamin D deficiency is a problem and that vitamin D supplementation is needed for probably most populations, as I had mentioned before. 94% deficient. Right? Vitamin D supplementation is essential for pregnant women and newborns. Vitamin D deficiency also precipitates and exacerbates osteoporosis. And so the issue has been, does it really reduce or increase risk of fractures? And deconstructing vitamin D deficiency, here you see very nice healthy bone, and here you see all the porosity due to vitamin D deficiency. And vitamin D deficiency increases early signs of aging in human bone. Very nice study that was done showing normal versus vitamin D deficient. All of these dark red lines are actually cracks in the bones associated with vitamin D deficiency, increasing risk for fragility of that skeleton and fracture. So osteoporosis is a silent disease, but osteomalacia is not so silent. Indeed, symptoms are generalized bone pain, isolated bone pain, muscle aches and pains. Nouveau diagnosis, fibromyalgia. Turns out that most of these patients I see in my clinic are vitamin D deficient and have dramatic improvement in their symptoms, correcting their vitamin D deficiency. Also, even growing pains in children have been associated with vitamin D deficiency. Here in the Mayo Clinic proceedings, they showed of 150 children and adults presenting with aches and pains in their bones and muscles, 93% were vitamin D deficient. It's classic. 23-year-old female shows up in the emergency department, weakness, fatigue, and non-radicular pain. Dysthymia, being depressed, is the diagnosis, NSAID is sent home. Asian female, same thing. This black male, he lucks out because he's wound up on a narcotic, sent home. They were all vitamin D deficient. 78-year-old male shows up with muscle weakness, atrophy, denervation, positive EMG, nerve conduction study for ALS. But also that patient was vitamin D deficient. Corrected the D deficiency, all symptoms resolved because progressive painless muscle weakness with muscle atrophy that manifests like motor neuron disease improves after vitamin D supplementation. You didn't have to use steroids because vitamin D deficiency causes proximal muscle weakness, and improvement in your vitamin D status improves muscle function, in part because you have a vitamin D receptor in your skeletal muscle. So if you ever wonder where Superman gets his strength from, there's no question about it that vitamin D is critically important for muscle strength. Indeed, very nicely shows vitamin D is good for muscle strength. We did a study, and others have done similar studies, and this study here done in Europe showed that physical performance, especially even in older adults, is maximum when the blood level is greater than about 30 nanograms per ml. We did a study at a nursing home and showed 72% lower risk of falling just on 800 units of vitamin D a day, and no benefit on these lower doses. So he's constantly complaining to his dog about aches and pains in his bones and muscles. And his dog told him, stupid, you're vitamin D deficient, right? So we want you to be at least 30, maximize your bone health, maximize muscle function, less likely to fall, less likely to fracture. So how do you treat it? Well, what you want to do, take a multivitamin. You only can take one of these because otherwise you're going to choke on them, and you're going to get too much vitamin A. So your tank is on empty, you get a gallon of gas. No. And so what you want to do, we treat 50,000 units of vitamin D2 once a week for 8 weeks. Why vitamin D2? It's the only one available as a pharmaceutical in the United States because it predates the FDA. No one has ever gotten the approval as a pharmaceutical form of vitamin D3. Pharmacies are getting from supplement manufacturers 50,000 units of vitamin D3, but it's not pharmaceutical grade. Once a week for 8 weeks, equivalent to about 6,500 units a day. And then, to prevent recurrence, I put them on 50,000 units every 2 weeks forever, equivalent to about 3,300 units a day. But you're worried, are they going to build this up in their body? So we did a study and showed after 6 years, an equivalent of 50,000 every 2 weeks, or 3,000 units a day, is effective in maintaining normal vitamin D status. Even the endocrine guidelines show 50,000 twice a month will maintain levels around 35 to 50 nanograms per ml. Also, no question about it. Why is his hair on end? Do we need to screen everybody? And so it turns out that no, because we showed many years ago 50,000 units twice a month for all comers coming to my clinic, that even if they were starting out at 50, the highest they were getting was 80 nanograms per ml. So we don't need to screen everybody. So R2D2, though, worried, but D2, is it less effective than C3PO or D3? And so we went to the Mythbusters, and we did a study, and we showed 1,000 units of D3 versus 1,000 units of D2. Placebo, D3, D2, no difference in blood levels. Indeed, we also showed 1,000 units a day to healthy adults in the wintertime in Boston will not maintain a level above 30 nanograms per ml. No question about this, right? Vitamin D toxicity, people worry about all the time. It's elevated calcium and elevated 25-hydroxy-D. Bob Heaney and us showed 10,000 units a day is perfectly safe. Study done in Canada, Pure North Group, showed 20,000 units a day to some adults was perfectly fine. What about children and infants? Study was done by Catherine Gordon at Children's Hospital, 2,000 units a day to treat D deficiency is perfectly fine. What about pregnant women? Bruce Hollis at Carol Wagner showed 4,000 units a day, blood level on average 50 nanograms per ml, no change in serum calcium and urinary calcium. Indeed, you can become toxic because a gentleman called me from Florida, a lawyer, and he said he wanted to sue me. Because back in the 1990s, I was already encouraging people to take 2,000 units of vitamin D a day. In the United States, back in the 90s, you couldn't find a vitamin D supplement. So he went on the internet and he bought this product, 1,000 units in a teaspoon, he took 2 teaspoons a day. I told him, look, before you sue me, send the stuff up, we'll do an analysis for you. And we did. The company forgot to dilute it. He was actually taking 1 million units a day of pure crystalline vitamin D. This will cause intoxication. He had a calcium of 15, 20 hydroxy D of 500. It's difficult to become vitamin D toxic. So why should you care about all this? Because once you make vitamin D in your skin, of course, it goes to your liver and then to your kidneys to get activated. And yes, your calcium regulating tissues have a vitamin D receptor. But over the past 2 decades, many investigators have shown that every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having an effect? The earliest observation was made by Suda back in 1979. Leukemic cells had a vitamin D receptor. Incubate them with active vitamin D, they became normal. So what about the vitamin D and cancer connection? Turns out a lot of evidence linking sunlight deficiency and vitamin D deficiency with increased risk. Back in 1915, it was shown that if you worked indoors, you had a 8-fold higher likelihood of dying than living outside and working outside, as these sailors are. Also, sunbathing can cut your risk of cancer. 1941, it was shown. If you live in the Northeast, you're more likely to die of cancer than if you live down south. And the Garland brothers showed in 2005, 50% lower risk of colorectal cancer just being on 1,000 units of vitamin D a day. Nurses' Health Study showed very nicely, nurses that had the highest blood levels, you would have to be taking about 3,000 to 4,000 units a day, reduced risk of breast cancer by 50%. Also, Bob Heaney's group showed that if the postmenopausal women who started out at 30 nanograms per ml and took an additional 1,000 units of vitamin D a day, reduced risk of all cancers by 60% in 4 years. Possible connection. Well, you may argue, this all makes sense. Because the kidneys, if you get more vitamin D, they're going to make more of the active form. It's an anti-cancer agent. It bathes all of your body. Turns out, yes, activated vitamin D inhibits cancer cell growth. But no matter how much vitamin D you ingest, you can't raise your blood level of 125 dihydroxy vitamin D because it's responsible for regulating calcium metabolism. That was a real conundrum. And it turns out, we asked the question with Gary Schwartz, and others did a very similar type of study, is it possible other cells have the capacity to activate vitamin D? And sure enough, we went on to show that not only prostate, but colon and even brain, shown by Dr. Jörg Reichrock, have the ability to activate vitamin D, regulate a whole host of genes, and then it cleverly destroys itself so that it can't have any impact on calcium metabolism. Estimated up to 2,000 genes directly or indirectly regulated by the active form of vitamin D. So what about your immune system? Turns out activated macrophages activate vitamin D. Why? It's actually pretty simple. A very nice study done in California by Maudlin and Adams and Liu showed, yes, cod liver oil and TB. Vitamin D protects against TB. Why? Because they published a paper showing that macrophages, when ingesting an infectious agent like TB, toll-like receptors are turned on. Why? To tell the cell to activate vitamin D. Why? It then tells the cell to make cathelicidin. It's a defensin protein that specifically kills infectious agents. So that's why solariums and living at higher altitudes was so effective in helping to treat and prevent TB infection. With the flu season coming in the wintertime, Hope Simpson had suggested that it's a seasonal stimulus. Well, at the peak flu season is at the blood levels of your 25-hydroxy-D are at their lowest. And so a study was done in New Haven, Connecticut, showing that adults with a level around 38 nanograms per ml reduced risk of upper respiratory tract infections twofold. A study done in Japan showed school children, 1,200 units of vitamin D a day during the wintertime, reduced risk of influenza A infection by about 42%. Diabetes. The higher the latitude that you live, higher is your risk for developing type 1 diabetes. Indeed, it was shown in a study out of Finland, Happonen followed children who had received 2,000 units of vitamin D a day in the 1960s for 31 years, showed that if they were on 2,000 units of vitamin D a day for their first year of life, reduced risk of type 1 diabetes by 88%. Right? Look at this. They started decreasing the vitamin D intake in Finland because they were worried about toxicity. And look at the incidence of type 1 diabetes on the rise. What about other evidence? Your beta islet cells have a vitamin D receptor, and active vitamin D stimulates insulin production. And Pittas showed many years ago from the National Health Survey, the higher your calcium and vitamin D intake, 33% lower risk of developing type 2 diabetes. Multiple sclerosis, again, living above that magical latitude of about 33 to 35 degrees. If you live above that latitude for the first 10 years of your life, 100% increased risk of developing multiple sclerosis for the rest of your life. Study done, again, Nurses' Health study showed women taking more than 400 units a day reduced risk of MS 41%. And rheumatoid arthritis, out of a study out of Iowa, 44%. Osteoarthritis has been associated with vitamin D deficiency. Peripheral vascular disease from the National Health Survey showed 80% lower risk if your level is at least 30 nanograms per ml. Also, Zitterman showed nicely heart failure associated. Mechanism, up to 200 genes in the cardiovascular system regulating atherosclerotic production, blood pressure control, and heart function. Indeed, in circulation, Framingham Heart study showed if your levels are around 15 nanograms or lower, 50% higher risk of having a heart attack. Also, it's been suggested if you take your calcium supplement, you're at increased risk. But a nice study out of Nurses' Health study showed almost 75,000 women, 29% reduction in cardiovascular disease for those who took their calcium and vitamin D. What are they thinking about? Tell you what, teens are at risk. The National Health Survey showed up to 50 million teens, higher blood pressure, and elevated blood sugar and metabolic syndrome. We did a study with Dr. Dong in Georgia and showed when we gave teenage African American boys and girls 2,000 units of vitamin D a day, just for a few months, it reduced arterial wall stiffness, kind of the prelude to hypertension. If that doesn't get your attention, this might. All studies have shown if you increase your vitamin D intake, you are less likely to die. Indeed, here out of Germany, 25% all-cause mortality reduction. And Garland showed 40 to 50 nanograms per ml is your maximum effect, and even out to 70 and greater, that you continue to have that benefit of reduced mortality. Is there any other evidence on the immune system? Well, ultimately, your genes know. And so we did a study. And we took 8 adults and we gave them vitamin D and did a chip analysis. All of these blue lines are underexpressed and all of these yellow and orange are overexpressed genes. We found just giving them 2,000 units of vitamin D a day altered 291 genes and about 80 different processes, including DNA repair, apoptosis, oxidative stress, as well as other factors. Feed your genes right with vitamin D. Right? And so what about maintaining your blood levels? Vitamin D itself seems to be able to stabilize endothelial membranes. So vitamin D itself, independent of 25-hydroxy-D, may have its own benefit. And in worms, giving them vitamin D showed that it prevented age-related accumulation of proteins that are responsible for the aging process. Adequate vitamin D is critically important from birth until death. And so vitamin D deficiency is a disease of neglect. In fact, there's a amount of evidence linking it to these chronic illnesses. So don't think about a normal level, but a healthy level. We want everybody to be at around 40 to 60 nanograms per ml, just like them. They would need to be ingesting 4,000 to 5,000 units a day if they weren't outside every day. Goal should be at least 30, 40 to 60 is preferred. It's a major health issue with a variety of issues in terms of disease burden. Indeed, how much do you need? For every 100 units you ingest, when your level is around 20 nanograms per ml, you raise it by 1 nanogram per ml. So if you're in this range, and I guarantee that you are, if you're not taking a supplement, 1,000 units a day will not make an adult sufficient. Right? I recommend minimum 2,000 for adults, 1,000 for children. Conquer D deficiency, best source, Bond Bread. Back in the 30s, they advertised, if you didn't want your kids naked outside every day, eat vitamin D fortified Bond Bread. I know young adults would not be D deficient if they were still doing this, because back in the 1930s, beer was fortified with vitamin D. And indeed, I went on eBay and bought a can. FDA did not take kindly to drinking beer and having nutritional benefit, so they forbid that advertisement in 1937. Look, Johnny, a spider sunshine and playing to get your vitamin D. We've always known about the healthful benefits of the sun. How do you get the message out? So I naively wrote a book in 2004, and I pointed out, I don't advocate tanning. And that yes, excessive exposure will increase risk for non-melanoma skin cancer. But everybody worries about melanoma. Most melanomas occur on the least sun-exposed areas. And occupational sun exposure actually decreases risk. And there are the data. Lifetime sun exposure is associated with a lower risk of malignant melanoma. Journal of Investigative Dermatology, 2003. Ancestors' view, a little bit different than what the dermatologists think about the sun. Indeed, they tell you always wear sun protection, never be exposed to one direct ray of sunlight. Have you ever been on rounds with an online dermatologist? They definitely recommend no sun exposure. I like the kinder, gentler view in life, and Schultz epitomizes this, and his penis character, Linus getting no from his mom. Are you sitting in the sun? I hope so. A little sun is good, as long as we never do it. Perhaps 10 minutes a day this time of the year is about right. He was right on target. Indeed, this is what's happened to our sun. It's been demonized for more than 40 years. Right? Slip, slop, stop message in Australia. 40% of Australians are now deficient. Who's that? That's an Australian dermatologist on vacation, and they measured their vitamin D status. 87% were vitamin D deficient at the end of the summer. Also, your brain has a vitamin D receptor. It responds to vitamin D by increasing serotonin levels. It's been associated with schizophrenia, depression, and dementia. Even Alzheimer's disease has been associated with vitamin D deficiency. So many of these chronic CNS illnesses have been related to vitamin D deficiency. But what about the other issue? What about skin cancer and sun damage? So a very nice study was recently done by Felton and colleagues, concurrent beneficial effect of vitamin D production, and then looking at DNA damage. And they did this over a period of about 6 weeks, simulating sunlight in Great Britain for both white and people with increased skin pigment. Phototype 2, skin type 2, 15 nanograms per ml is what they started, and after 6 weeks raised to 21 nanograms per ml. Type 5, very dark skin pigment, only barely, if any, raised their blood level. What about DNA damage? They went on to show before, no DNA damage. And yes, 1 week after exposure, all those black dots are DNA damage, less in type 5. But after 6 weeks, there's a reduction in the amount of DNA damage because there are now repair mechanisms involved. So basically, you can essentially have your cake and eat it too. Some sensible sun exposure will not have significant damage to your skin. But it's really not possible with our lifestyles, right? You can't be exposed to sunlight from 10 a.m. to 3 p.m. for at least 30–40% of your body's surface. And that's why, yes, sensible sun exposure helps you with your vitamin D status, but you definitely need to think about taking a supplement. Because can you get it from your diet? And the answer is no. And so what do? Well, the best source is sunlight. But time of day, season, latitude, degree of skin pigmentation. So what to do? There's only one thing to do: develop an app, which we did. And so it's free on your iPhone and Android, dminder.info. It will tell you anywhere on this planet, any time of the year, how much vitamin D you can make, and it warns you to get out of the sun so you don't get a sunburn. Sunscreen on my face, but not on my arms and legs. And I, like all my family members, take about 4,000 units of vitamin D a day. Blood level, 60 nanograms per ml. Right? No question, we can get some vitamin D from the sun, but we still need to take a supplement. And that's the message. Right? Vitamin D deficiency is one of the most common medical conditions worldwide. If any one of these chronic illnesses turn out to be associated with vitamin D deficiency, there is no downside to increasing your vitamin D intake. Right? You don't need to be a genius to know this. We need sensible sun and vitamin D fortification programs and supplement recommendations. This is not a hypothesis. Should you be screening everybody? I hopefully have convinced you no. That most people in my clinic, we give them 50,000 units of vitamin D every 2 weeks, or equivalent to taking 2,000 to 3,000 units a day for adults, 1,000 units for children. But if you're obese, if you have malabsorption problems, if you're on medications like glucocorticoids that alter vitamin D metabolism, or sarcoidosis where you have a hypersensitivity, then yes, you've got to follow these patients carefully. I've written a new book called The Vitamin D Solution, and recommendation from the Endocrine Society: infants, 400 to 1,000 units. Adults, 1,500 to 2,000. Teenagers, in my opinion, should be treated like adults, but younger children, 600 to 1,000 units is perfectly safe. And if you're obese, 2 to 3 times more. Indeed, the safe upper limit, easily for infants, 2,000 units a day. Easily for children, 4,000 units a day. And as the Endocrine Society recommends, up to 10,000 units a day is perfectly safe. Vitamin D can help improve your health. And I hope that you have found this to be helpful, and I encourage you to get some sensible sun and take adequate vitamin D to satisfy your vitamin D requirement. And thank you for your attention.